Neurogenic blocking. Blocking muscle fiber action potentials are usually associated with failure of the neuromuscular transmission in the end plate. But the potential can also block due to other pathologies, usually in the terminal axon. In very rare instances, the potential is blocked within the muscle fiber and fails to reach the recording electrode. Here we will discuss the neurogenic blocking. If conduction is blocked in very terminal part of the axon, the muscle fiber will fail to generate an action potential. However, one cannot tell if the blocking occurred in the end plate or in the axon. The neurogenic etiology of blocking is more obvious when two or more end plates block together. In this schematic drawing, the site of blocking is proximal to two terminal axon branches. When conduction fails, both muscle fibers will show blocking. The chance that two end plates will always block together due to neuromuscular transmission defect is very small. To demonstrate concomitant blocking, we will also need another muscle fiber action potential for triggering purposes. In other words, we need at least 3 time-locked potentials to study this phenomenon. Due to blocking, the discharge rate of the blocked muscle fibers will become very irregular and affect the velocity recovery function of all muscle fibers involved. Hence, those potentials appear to move to the left or to the right. The end plates distal to the site of lesion may be normal, hence the jitter between these end plates can be normal. Yet, the jitter with respect to the triggering potential is abnormal due to nerve conduction abnormalities. This is a concentric needle EMG recording in a patient with neuropathy. The low frequency setting is 1 kHz. It shows a complex main spike and 2 late components. We will trigger on the first spike. Note the concomitant blocking and jitter in the late components labeled 2 and 3. Try to note in the upcoming recording that blocking and increase in latency occurs when there is a pause in the firing. This is supporting the explanation that a weak point in the axon is facilitated by activity and the reverse. This is opposite to what we see in postsynaptic defect on transmission, where increasing firing gives more blocking. Here are the discharges in the superimposed mode. The increased jitter in potentials 2 and 3, as well as instability of the main spike, is seen quite easily. Here are 10 consecutive sweeps. On the highlighted traces, potential 2 and 3 block together. Also note the parallel shift of their position to the left on the next discharges. When the jitter was measured with respect to the triggering potential, it was significantly increased. This is seen from the superimposed traces. There were 2 instances of blocking that we saw earlier. But when the jitter was measured between potentials 2 and 3, it is quite normal and there is no blocking. This confirms that abnormal jitter in this recording is not due to pathology of the end plates, but due to a lesion in the terminal nerve axon.